Venkatram, CAP analyst. I intend to present a solution called VeriWrite Compliance for clinical data. Well, I do have an @ sign, and I do appreciate what this means to the entire community. The aim of VeriWrite Compliance being to add VeriWrite Compliance to sensitive clinical data or patient data so as to reduce the effort that goes into recording, organizing, maintaining and protecting collective details. The scope primarily being practitioner or healthcare provider related patient data. We've tried to describe the term confidential and sensitive to mean details that are meant for the patient and practitioner or provider only. When it comes to our vision, it's called very safe healthcare. That's veritable and safe healthcare. We do have a URL out there, which is a proof of concept, and we intend to integrate this implementation into panels in this website. Well, when it comes to the solution and why is it different, we first say that for any records management, it's important to know that access is not always controlled and it is not done in a simple manner. So to include the compliance and regulation we speak of, the solution differentiates the type of clinical data being recorded. It states that the data differentiated could be vital data, which could mean blood pressure problems, or it could mean insulin related problems or heart problems, and various other vital sign related parameters. It could mean non-vital data, which we go on to describe, or it could mean line icon specific data, which yet again is something which we try to add to our solution so as to be able to address what we see as the next step in clinical data management. As clinical data records may already exist and may not have any indexing or may not have the secure access that we look out for, this solution recommends integrating a machine learning algorithm that can read the data at first, frame skeletal sections, and later populate it via a separate implementation. How do we incorporate the solution? We state first that we would like to record details via a new companion card format, and the format talks about vital details, non-vital details, and line icon specific details, all of which help understand the person's or the patient's health condition. Beyond the vital for healthcare, the companion card also permits the practitioner or consultant to record what we call as confidential or sensitive data with the use of a new VeriWrite number. So it's kind of an indexing number which has been described in the documentation that we provided. The VeriWrite number will not permit people who we think are inappropriate are not auditable. So it's it helps track who can see the kind of confidential and sensitive information that's being recorded managed via the records management database. And we feel that this is where the @ sign could control the access. When it comes to the VeriWrite compliance, it helps permit the review. We always think it's important to review the manner in which the data is recorded, but it's not necessary that the data recorded is visible, accessible to the person who would like so. This is done only on the basis of level of access and privileges that the person may have. Now, when we talk about the ad platform, we're quite happy to have gone through the preliminary details about the ad platform, and we find that the various services or what we call as the functionality being provided could be leveraged in the following manner. We could use the @ sign to control access or recording of VeriWrite data, or we could use the @VY page to refer to the companion card or to store companion card details for a person. We could use the atmosphere to transfer companion card details or files or prescriptions or even diagnostic summaries. We know that prescription or diagnostic summaries are basically possibly what is recorded in the system or possibly what is written on sheets of paper or printed on sheets of paper. So we look at scanning or converting to KML, that's a keyhole markup language to do this. Now we also thought that the @buzz could be used to regulate or delete access to transferred companion cards, prescription or diagnostic summaries. The main purpose being that data transferred should be withdrawn, access to it should be withdrawn, or it should be deleted so that unwanted available information is not a problem anymore. We've tried to describe VeriWrite compliance in terms of two scenarios. One scenario being when the practitioner is working in a healthcare provider site, and the other scenario being when the practitioner or the consultant is working from an independent clinic, possibly a business. So when we talk about the first scenario, that's the provider practitioner scenario, we feel that our VeriWrite dashboard, because we are basically proposing a solution and we expect a lot of design, development and deployment to go into this. So we feel that a VeriWrite dashboard can open up access to a VeriWrite clinical records DB. And when we talk about the VeriWrite dashboard, it basically it permits access either from within the healthcare provider site or within the clinic, or from outside the framework, which is normally controlled and normally secure. And when we talk about the VeriWrite clinical data, we know that we're talking about a new solution called the companion card. So we look at basically a card storage and information transfer implementation. Some of this has been described in the documentation provided. Well, going to say that we think this is possible when we talk about the implementations that permit information transfer. We step through to see what else we can talk about. We find that when we talk about differentiating data, pooling data, we could pool them in a database such as the master DB, which is kind of a master to all the information which is being recorded. Then there's a physician's DB, there's a practitioner consultant DB, there's a disease DB, there's a procedures operations DB, department-wise DB, location-specific DB, quality indicator DB, and a machine learning algorithm DB. Though this may seem a lot, actually we found that the records management needs to address requirements which are specific to each of the categories that we mentioned here. Okay, when it comes to the implementation for this hackathon, we will talk about protecting data, which would normally be disease data, procedures and operations data, which are related to a particular person or patient. And we talk about access, which could normally mean open access or uncontrolled access, or it could be what we call as a normative confidential, where the data is available to everybody at the provider site who has the password or the access to it, and the provider normally would have consultants or practitioners working. So it would mean that they too have access to the data. And also it means that the patient would be given the records in an appropriate format, so the patient or the person also would have access to the data. We are stepping past this to say that via the ad platform and via what we talk as VeriWrite Compliance, we can bring in what we call as exclusively confidential cases, where this talks about the solution that the hackathon is trying to bring up. We find for anything, naturally there could be, for anything which is new or anything which has to be implemented on an existing framework or within existing parameters, we could have settings. So the settings could be not to be disclosed without permission setting, where we talk about not disclosing information without policy, which we expect would be followed by the practitioners or record keeping personnel. And we could also have a not applicable status, where the department does not want to implement the VeriWrite compliance, or there could be a no status, where basically the department yet again decides no database pooling is required. But going to say basically, if we're talking about this hackathon, we would go for the setting called as required status, which would definitely mean that the data being recorded has to be differentiated, and when it's differentiated, it could be indexed and prioritized into different data pools, and it could also be secured via the VeriWrite number and the ad platforms, ad sign, and various other modalities which we think we would like to take up as we go further. So here we see an illustration of a fragment. It's not a complete illustration. The complete illustration is in the PPT, which we have enclosed with the submission. So this talks about a practitioner provider scenario. As we see, there are two types of dashboards. There's a VeriWrite dashboard, which is specific to the provider site or the provider clinic or the practitioner site or practitioner clinic. There's a cluster DB or a cluster dashboard, where we talk about accessing data from outside, where talk about the perimeter being beyond the regular site or the facilities that we expect to work within. And we see that the VeriWrite Clinical Records DB has various indexes of the data which is being pooled. And yet again, as is not apparent in the illustration, the DB is populated by a card storage information transfer mechanism, and the information being transferred is companion card data and various sheets which we attach so as to implement the VeriWrite compliance that we speak about. Now similarly, the next illustration talks about the practitioner-patient scenario, Yet again, this would mean it's not the complete scope as in the provider scenario. It talks about a smaller scope. So we have databases like the master DB, disease DB, and the procedures operations DB, along with what is new as what we call as the line icon machine learning algorithm database. Yet again, we have a VeriWrite dashboard and we have a cluster dashboard. So the cluster dashboard talks about cluster databases, which actually means indexing into the databases which have been pooled. So this is yet very similar to how we described the earlier scenario. Now when it talks about recording data in a new format, we thought it necessary to describe the companion card format. So we have certain basic details like the name and the blood group of the person. We know that there could be an error while recording the blood group, or the person may not know. So we feel by policy that whatever be the blood group recorded in the companion card, it must be cross-confirmed before any line of treatment. When it talks about, when the companion card talks about medical history, it talks about medical history details with vital sign information like just problems related to blood pressure, insulin levels, heart problems, so on and so forth. It also talks about a new requirement which we are aware of, is immunization, where we're talking about the COVID-19 vaccination and so on and so forth, and also whether the person has any prescription medicines, because this is something which matters before we start a line of treatment, and yet again whether the person has any treatment at all, where the treatment at all basically talks about where care must be addressed to first find out what this treatment is about before one goes further into administering medicines or for the line of care. And as we said, as this is supposed to be a short pitch, we no, we basically have omitted certain excerpts that are part of the companion card. Going further, we spoke of a new concept called as a line icon specific data. Line icons we feel could mean for a person selective first aid details. It could mean food sensitivity and allergies that the person is prone to, any drug allergies that the person is prone to, any risk differentiator or physical disability that the person might want to indicate earlier or may be affected by. We also talk about wear-ons. We feel that tomorrow is not just wear-ons like a hearing aid, or it could be a pacemaker. It could be further advanced, where we think that knowing about the wear-ons applicable to a person help us address the clinical data management required for it. And we feel that via clinical data management, the line of care and also the perspective of getting the first treatment right can be most effective. So we talk about the line icon. It looks at creating data pools beyond disease and procedures, and we see that who could be using the line icon data would mean not just the provider or the practitioner framework. I mean, it could actually stretch across to a new secure health network, which we try to describe in our documentation, a disaster management network, or a first aid services network, which we feel by themselves have their own requirements, much more than expecting a practitioner, a consultant, or a healthcare provider to do the needful all the time. So going further, it basically talks about how the data can be recorded in the confidential and sensitive section of the companion card. One, it could be recorded by the practitioner into a database. So the person may be IT savvy or tech savvy. Next, it could be written down in the diagnosis summary in a separate format. Otherwise, it could be put into prescriptions. Otherwise, it would be recorded officially offline. That is not in line with what the practitioner consultant is doing, but with the record keeping that happens a little later. So when we talk about the level of access, as I said earlier, it could basically be not to be disclosed without permission. So if we have to enable permission for such data, we would like to use the @ sign. Having the person enter the @ sign and pairing up the necessary keys would enable access to that kind of data. We're talking about exclusively confidential data. We're talking about normatively confidential, and also what's not confidential, because we believe to transition from where we are to the VeriWrite compliance step may mean much more than what we speak of today. So when you talk about VeriWrite compliance, okay, to summarize, we have three sections: a clinical data section, a disease section, a procedures or operations section, where we try to actually start differentiating the data and the detail so as to be able to manage it and control it better. When you talk about card information storage, Naturally, we start off by saying that it could mean storing a prescription, so we have prescription data logger. It could mean storing a diagnostic report or a diagnostic summary, so we have data logger for that. We also talk about healthcare providers, needing healthcare policy networks, that is the third-party administration networks to play their role. So we talk about a logger for that too. Going further, we talk about VeriWrite data services. These are the services that help read, write, update, or delete the companion card data, where data could be collective detail or it could be keyhole specific. We also talk about a new possibility, that is a GPS card keyhole data logger, which helps transfer the card information from a GPS location in the KML format. And when it comes to card information transfer, we believe, okay, if we want to take this further, instead of just relying on any other solution which may be there in the market, we would like to integrate all this into a VeriWrite dashboard service, VeriWrite dashboard infrastructure. And actually, we would like to use the atmosphere using the at sign. We would like to use WhatsApp because looking outside the VeriWrite infra, we have certain other possibilities. We would like to definitely leverage and use them. We also have the VeriWrite email, which would permit information transfer. So this means if the file or the information is not controlled by the VeriWrite infra during the transfer, then it's necessary for a service to actually look for this data arriving in a particular folder and then going further to store the same in the database. Thank you, and this is about all. And we would like that people access the website that we mentioned earlier. And all the best to all the participants who take this further and find the necessary solution. Thank you.